Hello, hello.
Hello, how's it going?
Pretty good. How are you?
Good. Welcome back.
Cool. I'm gonna sit up straight. Thank you. Is it just us?
Right now, yes.
Do you?
But wait.
Okay. Everybody.
Good afternoon. Hi, good afternoon.
Hi, good afternoon, everybody.
Hello, hello.
Hi, Kim. I should be stationary in a few minutes. Good afternoon, everyone.
Sounds good. Good afternoon.
Yeah.
I certainly hope December weather makes up its mind. I mean, I'm not going to complain about 70-degree weather, but I came out with a full coat this afternoon and had to go back in and get my other jacket.
I had no idea that's what was happening outside.
It's gorgeous.
Wow.
So I won't complain.
What a way to start the winter.
Yes. It's about 3:30, but we'll give it a few more minutes for a few more to join if they will join. I do apologize that I'll have my camera off. I'm commuting to pick up my daughter this afternoon from school. But I will be present and engaged as much as possible in interim. So I'm thanking Kim and Taylor so much for their guidance and preparation and direction while I am away from my microphone.
Now, I will have to leave a little early today, around 4:15 or so. I have a meeting on campus that I have to attend.
Okay. Perfectly fine.
Now, I do have a question regarding the feedback for some of the curriculum. I started on one module, and I'm going to be working on some others. Were we supposed to meet as a subcommittee to perform those actions, or were we supposed to work on them individually and then report back to the subcommittee or full committee? I was uncertain.
That is a great question, and that's something that we can definitely flesh out during the meeting. Hopefully, we do get to it before you do jump off the call. But we're hoping that we can address some of the modules either within a subcommittee, and then you're able to meet separately, or if we just need to attach it to one of our meetings when everyone is available, rather than trying to establish another meeting. But we can certainly discuss that today, and get everyone's opinion on how to move forward with that.
Okay, thank you.
And so while waiting for others to join, welcome to those who are joining for the very first time. We are glad that you are meeting with us. This is November's meeting for the Health Equity Workgroup. My name is Dirk Caesar Coyote, I'm co-chair of the Health Equity Workgroup. And I say co-chair because the other co-chair position is vacant, and we're definitely looking, and we'll welcome someone who'd like to step up and help collaborate and lead this lovely work group. So I'll just quickly put that out there, and we'll discuss that a little bit later as well. But please feel free to put your name and if you're affiliated with any organization in the chat. Do we have anyone that's new joining us today?
Hi, yes, this is Rachel Sherman with Hospice of the Chesapeake. It's my first time attending a meeting.
Welcome.
Thank you.
I think everyone else might be returning.
Oh, okay. Well, welcome back to all of our returning members. Kim, if you could help me out with the agenda, I'm commuting, so I don't quite have that up. But what do we have next?
Sure thing. So today, right now, we just have the agenda up. So we were just going to walk through and finalize our goals and objectives for the Community Health Improvement Plan, have a chance for some health equity champions updates, discuss the health equity work group co-chair recruitment, and then open it up to any announcements. So first we have, we have our vision to remind everyone. And Xerxes, sir, I know you're kind of multitasking right now, so you can cut me off if you need to.
No, please feel free to go ahead. I don't have the vision up, but please feel free to go ahead and state it. And I'll preface this by saying that we like to start off by stating what the vision of our health equity work group is for any new members joining, for any members who haven't joined us in a while, just to kind of keep this fresh and in the back of our mind as we're moving forward with, some of our goals that we're trying to implement. So we have always in our mind the why. Why are we doing this? Why are we proceeding to do this within?
Thank you. So our vision, to remind everyone, is Prince George's County is a place where everyone has equitable access to achieve their full health and wellness potential, regardless of race, color, religion, country of origin, immigration status, class, age, disability, sexual orientation, gender identity, or health literacy skills. So I think at this point, we're going to dive right in. So as I mentioned, part of the deliverables for the Healthcare Action Coalition is completion of our Community Health Improvement Plan. Social determinants of health is really the main focus of the health equity work group, and social determinants of health was found as a priority for the county through the community health assessment. So our group is now, our role is to take that and determine what we want to work on to help address social determinants of health and health equity through our goals, our objectives, and our strategies. So I have all of this information in the next couple of slides is still in its draft format. We have talked about these goals and objectives before, and since that time, we've welcomed Dr. Levy, our new health officer and the co-chair of the Healthcare Action Coalition, and his feedback on those goals was that it was a little bit pie in the sky, that we needed to really streamline and get some more definite action items and strategies that were very clear, that we could very quickly tell someone what we're doing and they could understand it from these goals and objectives. So please feel free to interject at any time and provide your feedback. We want this to be community driven. We want all of these initiatives to come from all of the organizations that are participating. So without further ado, goal one is to promote the implementation of health in all policies, or CR 127/2020. And then our second goal is to enhance the accessibility and inclusivity of public health messaging across communities. So before we dive into really the objectives and the strategies underneath of these goals, does anyone have feedback or concerns about the language or the goals as a whole? And I know I see that we're still welcoming people into the meeting. So hi, everyone. As you're coming in, feel free to put your name and organization if you're affiliated with one in the chat. Right now, we're just talking about our work group goals and making any final edits before we really start adding these into our community health improvement plan. Okay. Well, hearing no initial feedback about the two goals, again, feel free to just speak out or put something in the chat if you have any feedback. We can dive into these a little bit deeper. So looking specifically at goal one, we have some draft objectives here. So first objective, by December 2024, engage the County Council Board of Health to advocate for health in all policies. This actually reminds me, typically we have a space in our agenda for our Board of Health liaison. Dr. Blocker, who we met at our last meeting, is moving on to a new role outside of the County Council Board of Health. So we'll be waiting with anticipation for the County Council to define a new liaison. But that is why Dr. Blocker is not representing that position today. So we'll stay tuned and continue to have that in our action items to define someone who can represent County Council in our group. But with that, does anyone have any thoughts or feedback on objective one? All right, hearing none.
Well, I guess I'll just ask a quick question. And I'm not sure if maybe Anya, if you have some perspective on this. Not sorry if I'm putting you on the spot. But do we have kind of a pulse or a temperature on where county council or the board of health is on the health in all policies, like whether it's on their radar? Do we need to implement anything to kind of remind them or put it back on their radar? Like what's the pulse, if you know of it?
Absolutely. Good afternoon, everybody, and thank you for this question and comment. We do have a lot of relatively new council members, and so since this legislation dates several years back, I do think that it is actually important to advocate specifically on on moving forward with health and all policies, because that bill was passed initially, that resolution by Ms. Danielle Galeros. She's no longer on the council. So, and most people, and now Miss Bligay, she's the one, she's the vice chair of the council right now, and she's primarily responsible for running the Board of Health, right? So basically this bill doesn't belong to anybody who is on the council now. So I don't know to what extent they understand the concept of health in all policies, and B, to what extent they are committed to moving forward with this. And obviously we have, new new health officer. We have, Mr. Ariol is also relatively new in his role, and we heard from previous DCAO for Health and Human Services, like that they were going to move forward with this effort, and they haven't. So I do agree with you that there is actually a need to really revisit this, and for the new council members and even for the new DCAO to recommit to actually moving forward with health and all policies for the county. Thank you.
Thank you so much for that perspective, Anya. That provides a lot of context for us right now. And then, so I'm really considering if maybe changing that by December 2024 to maybe something a little bit earlier. You can definitely give ourselves some grace, but maybe cutting that year goal into maybe 6 months, or maybe even 3, if we can be able to place ourselves on their agenda, or something that to revisit the CR 127 2020.
And I would recommend, getting into direct communication with Ms. Blagay. So she actually sets the agenda for all Board of Health meetings. I'm her assistant, and she's doing all of that. So please feel free to reach out to her. And another great advocate that you will find is Ms. Crystal Oriada, who is currently the chair of Health, Human Services, and Public Safety Committee. You can also send letters to her. And as you may know, Council Member Olson, he is the one who is very interested in behavioral health. So he is also an advocate for health matters and should be interested in health and all policy advocacy work as well. So just feel free to reach out directly to those folks. I mean, feel free to mail letters to all of the council members explaining why this is important. And I don't know if you have felt it, but I definitely put a plug, for Healthcare Coalition. We were successful in making sure that the mental health town hall was led by our health officer, so we're trying to increase the visibility of this particular body, and also giving, a role, to our health department to explain and provide their input on some of these issues.
Thank you so much, Anya.
I was kind of thinking that I'm sorry, Sharon. I think I started as soon as you put your hand up, but I was kind of thinking that a good sub goal here, and I think this goal is good. I was thinking maybe by December, more realistically, we could have a plan formed and a procedure formed, because I'm not sure it's always clear how the coalition should engage with council in terms of its sort of positioning within the executive branch. And so I think there's some clarity that probably we need, just to make sure that we know how to approach that, and then we can further define what does engage look like. Can we make sure we have Dr. Levy and Dr. Ariola on board, that our health equity co-chairs are going to be meeting with council members to talk specifically about implementing this resolution, and make sure everybody is all on board, and then then begin the actual advocacy work, and then building what that would look like moving forward in terms of the coalition's role.
Go ahead, Sharon.
Okay. Actually, Caitlin, you brought up that one of the issues that I was going to bring up, which is that because of where we're positioned in the executive, there's a process, some sort of a process that needs to be followed before we can't just jump out there as a group under this name. We could jump out there as individuals, but not under this group name. And the other question I had was, and this is just me having a senior moment, I can't remember, since much of the council is new, do they need just a general reintroduction to the Healthcare Action Coalition and its work groups? Or has somebody done that already? Or is that somebody's job to do that?
I don't think maybe it is. It hasn't happened. We'll say that.
Okay.
I know they literally just finished their intro meetings with Dr. Levy. So I don't think, probably he was just getting to know folks in that initial meeting. And I know they're in session until the end of November. So no, that hasn't happened, but that's a good idea. I think we should do that as part of this like council engagement and education piece.
Yeah, and speaking of education, since there has been quite a bit of turnover, I know that was something that this coalition, this work group worked on to get the council educated on health equity, health and all policies, how to forum. But if there's turnover, it sounds like is that something that we'd want to do again? And if not, I think maybe there also needs to be some sort of, maybe we can recommend ways that new council members get up to speed with these types of even if it's not this coalition, or I mean, this coalition or work group having an involvement, but that's part of like onboarding and orientation as a new Board of Health or county council member.
I think that's a great idea. I know in terms of the reintroduction to the coalition as a whole, there's definitely those steps that we need to define for the outreach. Making sure that we go through the liaison. And then was anyone, I guess, Christine and I think Sharon and Caitlin, were you all part of that original group that provided the training? To the last round of County Council Board of Health?
Well, are you talking about sort of those big trainings that we did? Because we did 2 big forums that were well attended by not only county council, but by the business community, the nonprofit sector, department heads, and other folks. So we did 2 of them, and each had like 70 to 80 participants in them, and it was a big deal. It cost some money, and I thought were very well done and effective at sort of getting people to think differently about health. So, and we had talked a lot about having a similar training just for the Department of Health, not Department of Health, I'm sorry, the Board of Health, just on health equity. And that never happened for various administrative and time reasons, I guess. So it may be that we want to revisit offering a training, but it sort of got bogged down administratively because I mean we're not really in a position to say, here, you need this training to the county council. So we have to figure out if we would like to do something like that, how to do it, whether to work it into a strategic planning session of theirs or something else, and then really plan. It would have to be very well planned, concise, and effective.
So one of the conditions under CR 127/2020 is that County Council Board of Health completes that training or some kind of health equity training. So really, if we found a way to help them achieve that goal, it feels like a win-win.
Yeah, I was just dropping that language, specific language from the resolution.
You guys are so on it.
I mean,
Thanks, Christine.
when you spend a lot of time on it years
Yes.
ago, these things like I was like, I know that was a part of it.
Yeah, that's awesome.
So I mean, is it just appropriate just to like then in terms of the steps, just kind of reintroduce the coalition, bring up this resolution and some of the stuff, and also maybe reference Dr. Askew's, because he did a whole presentation on next steps, et cetera, et cetera. And I would imagine that nothing happened because soon thereafter he left. Is And I can't even find it.
Might be able to find it. I know one of the really big issues, obviously, is that there's no money associated with it. And that's always a problem.
Caitlin, what I know there have been other there have been other health related, or does anybody else, and I would imagine you may be in the best position, Caitlin, to know where to identify the other health related resolutions that have happened and been adopted more recently, and for us to help see if there's any just existing tie-ins. Because I thought I heard that there were some that were passed and over the last 3 years that had some similarity, nothing overlapping completely, but
That's actually a great question, and is something that I should probably categorize, or I do this with the state legislation. I have like a summary that I send out with everything, but I don't do it with council, and maybe that's a need. So um
I didn't mean to put any work on your plate.
no, I
It's
think, I
just
mean,
it
because
is. I mean,
yeah,
I
it's
just find it
important.
hard to navigate sometimes the website
Yeah,
to figure out.
it's very hard to navigate. Yeah.
Right.
So
So
yeah.
anybody with any inside knowledge, would be great just to even put our eyes on what those other resolutions have been, because I know for a fact there's been one or two that I'm like, huh, sounds very like there were elements and somebody forgot or didn't know that the CR 127 2020
Yes.
existed. So I mean, it probably sounds like any work or coordination or links showing council, where there are existing tie-ins to things that they're already working on and thinking about may be beneficial.
So maybe if our overall goal, so okay, so let's think about that. So if we're forming a goal, okay, I'm sorry, it's been a long day, but what is the goal of us engaging county council? Is it to provide them with the background specifically on health and all policies and to really like focus on implementing that thing that we already passed? Or are we trying to really like build a relationship with them where, we're aware of their health priorities and what they're putting forward, where maybe one of our strategies is to have tabs on like all of the health legislation that comes up and send people to testify on it in the public hearings, or as people, or maybe or are we kind of just wanting to focus, is that a little bit too big?
Anya just said, can we do both? And I agree with that statement that we really do need to do both. So maybe the discussion that we're getting into is around strategies, is maybe broaden the objective a little bit, or add something that says something about aligning the work of the Health Equity Committee with Prince George's County Council. And we could even say Prince George's County, with Prince George's County Council health priorities or something like that.
It feels like for those here for a long time, we have to do all over again. I mean, just listen to the back here. I think we had very, very cool training sessions in the past. I think it was very interesting, the concept of health equity, bringing everybody into it, not only the council, but the stakeholders. We have to do all over again. And this is part of our job because politics change, new people get elected, people leave. We cannot get tired of it. We have to just keep repeating. I think in my sense, in order for us to engage the county council, we need to feels like explaining the coalition, right? A little bit. I think you mentioned that, Sharon, before, and I think Kathleen said yes. And then find a way to explain again the concept of health equity and the concept of health in all policies. So I think there's two things going on. One more presenting the coalition, the other one really trying to strategize a training session to them. Of course, as Anya said, if we can call them already and say anything will be great. I think any of us who had opportunity to say anything about it should start really educating the new council, right?
And it just in my head, I was sort of thinking about how, we had some very, very strong health advocates on the council, and I think that there are also strong health advocates and health equity advocates on the council. Again, we just don't have relationships with them. So it's really rebuilding those relationships with council member Oriata and Blege and Olson, as Anya said. And maybe it's sort of setting up a meeting. I mean, what I'm thinking is the place where we might start is with the Health, Human Services, and Public Safety Committee, so that they can sponsor. I mean, they would be the ones who would need to kind of say, gosh, we really need this training, and suggest it to their colleagues. I don't know that we're in a position to make that suggestion on our own.
Yeah, I think that also the turnover, I feel like this kind of highlights, like, we put so much energy and time into the last council, and that really, I sort of joined once the energy and time was already being invested. So I don't know if they started out as champions and then I would be curious kind of the impact that it had specifically versus like if they were the impetus for it. But I wonder if part of our goal could be like developing a sort of like an orientation process or and maybe this is like a broader coalition goal as well as a health equity goal for what happens when a new council person comes in. Like, our protocol is we meet with them and give them this orientation to what PGHAC is, and then specifically like what health equity, I don't know, just an idea kind of what our priorities are or something like that, so that in the future, because this is going to keep happening, we have a framework and we haven't invested all this time in sort of a one-time thing that ends up going away.
I like that too. I think that would be really valuable. And I think that if we define that kind of process, it would make it a lot more sustainable than kind of just saying, oh my gosh, like there's a bunch of new people that don't know, we should schedule something. And I do think that in terms of setting up, how do I want to say this? Setting up this kind of system where the Healthcare Action Coalition is that advisory board that we've kind of discussed in the past, that this building this relationship through the health and all policies could kind of be the step one towards that. It could be like the great example of how we can engage. But I'm also happy to, kind of update the language, or, is it a separate goal? Or I guess the other question is it a goal that goes under the coalition as a whole?
Yeah, it's an interesting question, right? Because I think who should explain that health should be in all policies is the health equity working group, right? Even though this brings together the whole coalition as an initiative, I would say, right? I mean, I think maybe it's time to unsilo this in a sense, but I think the charge is a little bit on us because I think we are the expert of explaining to people that health is in our policies, not only access to healthcare, but also environmental health, how we understand health impact of other policies. So anyhow, it's not that we are more responsible for the coalition in general, but we probably were more responsible to educate on that level. And I think as a strategy of engaging the council should be to explain the concept of health equity, health in all policies, and explaining the initiative of a coalition like this, the broader coalition, to ensure there is community participation and input from the community and this expert on doing the job into what the council can use as you said, as an advisor, right? I think it could be a good segue. And maybe as reframing a new training, right? A new engagement. We had two very important experience before. Maybe we can have that as strategy to keep thinking what would be the next strategy to educate the board, right, on those issues. Maybe one of the strategies to educate them, and we create the tool or the how we're going to do it.
So you know what? It actually, my eyes jump down to the next goal, and part of this could be incorporated into the actual ambassador training, where you're getting community representatives. I mean, I often feel like it's presumptive of us to go out and do some of this stuff without having some community, really people who work deeply in the communities that are experiencing inequities and disparities the most, that they be part of the training, and the explainers of why this is so critical, to improving their lives in the county. So, maybe these are related. I don't want to overcomplicate things, but it seems like they would be.
I mean, what you laid out, Sharon, is what I envisioned. Hopefully, that's what I envisioned. So actually, I'm curious to see if that's not what other people envisioned. I'm wondering what it was in the ultimate goal. Because yeah, I saw just a community of informed residents of Prince George's County and other stakeholders, who could advocate as well for health. So it's not just us.
Yeah, I'm actually thinking of sort of more formally incorporating, some of the residents or community-based representatives into whatever we do with the council.
And I shared it seems like there's a similar effort for the planning board, like a community planning academy. And but you have to apply for it, and it seems similar. So I don't know what their ultimate outcome is, or what they're supposed to be doing, but it seems like there's been some precedent in the county.
Yeah, this is cool. I didn't know this existed.
Just for us to consider, maybe we need to do two things because we don't have champions trained yet, right? Not yet. So maybe we should do two things because I think that the champions training, the product of the training should be them impacting right through. I see that as a vision for the future, but I keep thinking if we have to do something more immediately before we have, and even having some people from different organizations that already are trained in some ways or could be part of it, right? If you want to have this training or this dialogue with the county council be mediated by people who are dealing with inequalities, we can build on that with the expertise that we have or the network that we have. But I think it would be interesting to us to do not wait until we have the champions training to then start reaching out to some strategies to engage with the council. Just that. I think we can do two things parallel, my suggestion.
Great. Yeah, I agree. And I can go ahead and put up the third objectives. And I think these all very closely align. We're trying to increase community and our county council's understanding of drivers of health equity in Prince George's County. So maybe now we can kind of get into some of the language around the strategies and see, based on this great discussion, if there's adjustments that we want to make to these. So starting with development of recommendations for the implementation of health in all policies. So it sounds like we have a lot of action items that need to happen within this. And we've kind of spoken to those already, really, engaging Dr. Levy and Dr. Ariola, who can kind of build the force behind the introduction with the Healthcare Action Coalition to County Council, and then conducting a forum at some level. Maybe we need to define some funding to conduct that level of a forum or a training, and then see if we have some kind of system or policy in place for providing this training for new members of County Council and the Board of Health as they come on. Does anyone feel like the language around this needs to change to encapsulate all of that information, or do you think we can build it out within the action steps?
I just realized that it's December 2024 and it's making so much sense now. I thought this was by next month, and I was like, I just feel like this is a little ambitious, Kim. But okay, this is making much more sense.
And I know Zerxaser was saying we could even, make it a little bit more ambitious, having more of like a 3 to 6 month timeline for some of these, but we can kind of break that down once we get to the point of defining those steps. Mm-hmm. And then this next strategy is very much aligned with the creation of the Health Equity Champions curriculum, not necessarily pulling together the entire training series, but the development of that curriculum and the finalization of the curriculum with the Terrapin think tank. And then next, development of a pre and post program learner survey to measure the change in health equity knowledge. We've been discussing this around and trying to decide how we can measure success of the Health Equity Champions program, whether that be the learner's confidence in talking about health equity with leadership, But I think that we would need to develop something to really measure that, because I don't know that anything else exists. And then the rest of these kind of go into those later steps of implementation of the Health Equity Champions program. Any additional thoughts on some of these strategies? Okay, I'll start pulling up some outcome measures then. So kind of a low-hanging fruit is just getting our Board of Health liaison engaged. Once they're assigned, bringing them to the meeting and building that relationship. And then, so we could probably add some more outcome measures around development of a process for county council, but I'm open to any feedback around that. And then moving into the number of people enrolled in the pilot and or the final Health Equity Champions program, and then the change in that learner confidence. Any additional feedback on goal 1 before we move on to goal 2?
I don't want to lose sight of the suggestion that Caitlin made about setting up a framework for doing this that could be institutionalized as opposed to doing one-offs all the time.
And I just also wanted to note that my understanding is that even in CR 127 and just overall to implement health and health policies, it would actually take both the executive branch and the county council. So I was thinking if we need to engage not only the county council as the Board of Health, but but basically like everybody to achieve this goal. Thanks.
Excellent. We'll make sure making notes on the side instead of live on the screen this time, but I'll make sure to make some of these updates before we send out notes, and then we'll take any final, well, feedback is ongoing, but we'll make some final changes there. All right, so I will thank you, everyone. This has been extremely helpful. Moving on to goal 2. So this, again, enhance the accessibility and inclusivity of public health messaging across communities. So our objectives, we want to forge partnerships with at least 12, 12 coming from the idea that we would have a learner series at each of our health equity work group meetings, but of course, more organizations, the better. Develop solutions that address barriers to the delivery of public health messages. Develop a process for engaging community partners for the dissemination of public health messaging. And then increase the percentage of intended residents who receive public health messaging. So I will give us a minute to digest the objectives before moving forward. Feel free to jump in. Okay, I'll move on to the strategies piece then. So initiate a collaborative partner presentation series at monthly health equity workgroup meetings to capture specific considerations for health messaging for the community they represent. So previously we had a discussion around defining communities within the county that we need to make sure that we are representing appropriately and engaging for this work group so that we're getting their feedback. So I think our idea would be to take that list and determine which organizations represent those communities and then get them to kind of come in and discuss some of the barriers or considerations to messaging. And thanks, Anya. I saw your message that County Council can be a partner in getting health messages out. So I think that would be a critical piece of kind of, I think this next, the piece after that, which would be development and implementation, a collaborative communications framework to synchronize communications in the community and increase opportunities to reach the focus population, whether that be the entire county or a specific population that we're trying to reach with messaging around health. Again, I think Christine kind of hit it when she said that we could use the examples from COVID for implementation of this kind of framework. We found that through the ad hoc vaccine working group, we really identified groups and methods to reach different communities better. So I think, county council and government operations are a great way to reach the community, but also our community partners are people that might not be following closely or might not, have a great connection with the government. We can use the community partners to reach people and have a unified message so that the trust is there. But we want to kind of, my idea is that we make sure that feedback goes both ways so that we're sending messaging out through this framework, but also getting feedback around ways that we can improve the messaging to make sure that it's inclusive. Dr. Jackson, do you want to elaborate your comment?
So I was just thinking when I see this first objective and then looking at the strategies, like, are you all thinking as it relates to communities, is it by language? Is it by race, ethnicity? Is it by abilities? Is it by economic status? Is it a combination? And which organizations? Is it intersection of those things? I was just curious, like, what is the strategy to connect to your overall goal that I see here, and identifying and engaging, and then implementing these strategies. So I was wondering, is there a strategy that goes here to determine who and how you would connect to those individuals?
Anyone else can also jump in, but I think the idea would be that we would kind of work together to identify those groups. And we did a very brief, I think it was one of the sessions where we had like 10 minutes left and we tried to just collect this overwhelming amount of information around different groups. But I think all of the above, all that you listed, we're not like breaking people down by any certain characteristics at all, but just kind of brainstorming. And then hopefully as we get more people involved, we'll discover groups that we didn't include before. So I think it really, the framework can be expanded as much as possible.
And the other reason why I was asking, so I'm just thinking about the work that we're doing in the Center for Health Literacy. We we start out working with one particular community and one particular aspect, maybe it's language. And then as we are engaging with other communities, we realize, oh, not only is language a priority, but it's like the actual channel to connect individuals to information. So is it a digital platform? Are there some digital literacy things that we need to consider, digital health literacy? And so we've even thought about like, okay, should we be engaging and finding out from community partners? Are there certain priorities in which communities are focusing on, partners are focusing on, like by 2024 or by 2025, in that type of strategic way of thinking? Or is it, like everyone, all by 2024, or by 2025 or 2026? So that's, I was just curious. And I don't have necessarily like a right or wrong answer. I was just curious if there was a particular strategy that you wanted to note here or not. That's all.
So we've actually gotten some feedback from, I don't think Layla is on, but one of our partners, is a community member, has connections with a group that has started to put together a framework for kind of this community engagement framework. And I think one of our steps would be to utilize that framework to bring people in, and then build it out. But she doesn't have the approval yet to share. So they're just waiting for it to go public, and then we can utilize that framework.
Okay.
Here, some suggestion here. I don't know, maybe I missed something. I'm so sorry, guys. Sometimes I can come, sometimes I cannot. It has been like the 2023 has not been easy. Anyhow, hoping for a better 2024. But have we ever got the feedback or the results of the focus groups of the health literacy grant? I think we had a health literacy grant that the health department managed that produce a lot. I mean, at least I remember helping to recruit for some of those groups. I don't know if we can use that data here too.
Yeah, for sure. I'd be definitely happy to share all that information with you guys.
Yes, that can be something that we could use right away in terms of understanding. Of course, we would like to have people presenting. I'm not saying this is not important, but I think but at the same time that we try to figure out what should be the points. I think that those focus group results, for those who doesn't know, maybe Caitlin, you can explain a little bit that grant, but it was like an environmental scan that was done by that grant to pretty much asking people about health literacy issues. So I'm afraid of misrepresenting now, Caitlin.
No, that's accurate. Yeah, they did. So we did 16 focus groups with 8 different subpopulations that were in multiple different languages, and were focused on messaging broadly, but really with a lot of specifics around COVID-19. So that is somewhat of a limitation because with COVID, it's like old as soon as you get it. But I think there was definitely some like pearls of information in there about how communities did or did not want to receive information that would be really good to share. And I feel like they were underutilized. That information was slightly underutilized in general. So I would love to share that out. And we also in that grant, we implemented some tailored AHRQ tools, the Agency for actually not sure, Healthcare Research, HRQ.
Equality.
No,
Yeah.
Quality. Yes. Thank you. Someone who knows the acronym. And we implemented those with patients or I guess community members, just to help them understand, like, I mean, it was pretty broad, like what their rights are when they go to the doctor. Like if they don't want to if they don't like going to the doctor because every time they go, it's a different doctor, it's within their power to ask to see the same doctor every time, or, information like that, or bringing someone with you so that you're able to process more information, or planning your questions in advance. And we found really significant improvements after that intervention in patient provider communication. And that was only with the patient side. So now we're in a no cost extension year working on the provider side. But I mean like 25 percentage point improvement in satisfaction with patient provider communication. I was really blown away. So I would love to share that. I think that's a great idea. Thanks for thinking of us.
Leverage this. Yeah, leverages, right? Because I think sometimes we think we have to start from the
Yes.
scratch, and there's like already things. Even analyzing those subgroups, like are them representative, for example, is the subgroup that would like to moving forward in bringing them together for us to get where we are. Anyhow, this is my suggestions. It was a big investment on the county. We should use all the data, insights, and knowledge that brought to us.
Yeah, I think all of that sounds great. And maybe that's even noted that that's a part of the strategies, like utilizing these needs assessments, these folk, so then that's, I guess, keeping, like, to your point, us not like, we're utilizing resources that are already available, and we know where to go to really get to, okay, how we're going to engage, what are the priorities. And then it also has me thinking about what your outcome measures you might want to have when looking at increasing the percentage of intended residents who receive public health messaging. So like even your outcome measures, like, do you want, like, yes, they receive it, but are you interested in their knowledge of a particular health message, their attitude about certain messages? And I don't know, maybe not, but are those even things that you want to include? Their, increase in accessibility of certain information, either digitally, channel-wise, other forms of accessibility, like how are you defining accessibility and inclusivity? So those are just some quick things to maybe just consider as you're refining your objectives and strategies and measures.
That's very helpful feedback. So I think that on my end, I think it would be more of just gaining the understanding of how we can measure that. And, if we define a way to get those measurements, and I'm happy to add them into the outcome measures. I think and you all are the experts in that kind of information. So I will take whatever advice there is.
Okay. Well, I will definitely keep thinking about it and have that conversation with Cynthia, Dr. Bauer, as well. Yeah.
Great. And so, Caitlin, am I hearing that you'll be presenting on Health Leap findings in January 2024?
I would love nothing more.
Sorry.
Actually, I'm not even gonna lie. I would love to do that because I'm really excited about like what we found. So I will love to do that.
Excellent. Great. I know we've given this a lot of time, which it deserves. Does anybody have any final thoughts before we close out the goals section? Okay. And again, we'll welcome whatever feedback you have or thoughts that you have later around these as well. All right, so moving on to just give a quick update around the Health Equity Champions program. Last month, we kind of reached out and tried to find a more of a subcommittee team that was interested in providing the feedback to the modules. We did reach out to the subcommittees, and thank you, everyone. I know there's been a lot of notes going into those modules. So right now, in terms of our timeline, by this December, we'd like to provide our feedback to the draft modules to the Terrapin think tank. Really, they're getting it in live time because the changes are getting made in their Google form. But I'd like us all to kind of finalize or have any discussions around if there's any back and forth or confusion around that, and then schedule a meeting with the Terrapin think tank hopefully in January, where we can discuss those changes or answer any questions, and clarify things. So does anyone in that group want to provide any feedback or questions that they have as they've been walking through the modules? Okay, and then in February, after we have those conversations, we can really start exploring our options for program facilitation. I do think that we wanted to respond back to them that our focus would be on more of an online facilitation at this point, based on the resources available. And they just needed that direction because it changed the way that they would build the curriculum and the presentation. Great. Moving
I'm sorry, I
forward.
do have a question for you. As far as the subgroups, have folks been assigned to the subgroups, or how do you know where to contact the appropriate person for the subgroup so you can connect with them or work as a group to provide feedback, or individually? How does that work?
I'm not sure if Zerksacer is back in a position where she can talk, so I'll do my best. So right now we have kind of a general group of people that have been engaged in that feedback. We reached out to all of that group as a whole by email, not by module. However, I think it would be helpful if we can do a little bit more engagement of people by module. What would be the best? What do you all like to see? How would you like to go about that kind of those next steps? Like, do you want us to help coordinate? Okay, and then Zerksacer just said in the chat, not as of yet, almost. If you're interested in leading this effort, to reach out to me and let me know. So if you want me to help set up a meeting with everyone in this subcommittee, we can certainly do that. I know this time of year especially can be really difficult to get everyone together.
Yes.
So we understand that, which is why we try to keep it right now. We tried to, allow it to be more of an individual time led process whenever you had some downtime to just go into the module and check it out. But I do think that we'll need to have more of a collective meeting to kind of walk through it together before we finalize and have that discussion with the Terrapin think tank. So maybe I think the saying is it's beginning to look about that. It's beginning to look a lot like let's circle back after the holidays time of year, but it might mean that the best time for us to meet around this is in January, but I'm happy to take any pushback. If you all are motivated to meet, I will make it happen.
Sorry, I'll try and do my best. I have a little one in the background, so I'm going to apologize in advance if you hear her. So thank you for that, Kim. I think in the previous meetings we were trying to set aside time to do this, or to see if anyone specifically wanted to review, a particular module and then bring it back to the group. So we're just trying to see, what works best for the group, and maybe taking it module by module and just reviewing it collectively as a group. Perhaps we may get somewhere, but we just wanted to open it up to you all to find out how best, what would be best based on your time and availability in reviewing, and also your interest as well and your expertise in reviewing some of these modules.
I just want to clarify, the goal is to get these modules finalized, correct, by January? Or by the end of December at least?
It would be to finalize our feedback to the Terrapin think tank. And then they could take that feedback and respond to it and make the updates that we request.
So because the holidays are all mixed in there, it seems like it would be best to have people be able to go in and work on them as they can, with maybe an occasional reminder if you don't see changes going on, a reminder that people should be reviewing these, and see what we get to and meet in January as collectively to review. At that point you say, okay, these are the changes, and then go over them collectively, with the group.
So what I'm hearing, Sharon, is that we do have a shareable document that people can, or that members can review on and add their comments to. So based on what I'm hearing, it sounds like everyone can individually go in, take a look at that document, provide their comments, and then following the holiday, we can come back collectively as a group to review some of that comments and then provide that feedback to University of Maryland. Is that correct?
Yes,
Or
that's
something
what
like
I'm
that?
saying. I mean, I even think that if we wanted to, we could not allocate the time for the next meeting to people going in and doing edits. I mean, to keep the meeting on the calendar and say, go in and work on this.
Okay, yeah, we can certainly arrange that.
Perfect. Okay. I'm being mindful of time, so I'm going to keep us. So as Sacer mentioned before, we're looking for another co-chair. I just wanted to kind of list out some of the responsibilities that we look for in the co-chair. They would serve as the liaison between the work group and the coalition. Of course, they'll have the assistance of myself and any research assistants that we have on board. Expand the work group membership. So really being the person that can help us identify people. I know all of our partners are constantly doing this. I get emails about let's reach out to this person, or this person will be great. And that's a great method for us to bring people on. So again, another role that you would have support with. Establish a regular meeting time, serve as the moderator of the work group meetings, coordinate with members about work group responsibilities, lead the development of the work plan and key action steps to meet our goals. Report the work group activities to the coalition. So attending the quarterly meetings and acting as the voice of the work group, coordinating with our support staff for the logistics of the meeting. So we do have planning meetings between the monthly meetings to just help inform, what are we going to be talking about? What do we need to focus on if we're going to have any speakers? And then representing the work group and the coalition in the community. And then finally promoting the collaboration, any conflict resolution and decision making for the coalition work group. So if anyone is interested in either learning more or being considered as a co-chair, please reach out. I'll put my email in the chat. You can reach out to myself and Sacer, and we will be in discussion, but we definitely, it helps to have more voices at the table so we can keep things moving. We also understand that this is a volunteer position. So I try to be mindful of everyone's regular responsibilities with the role as well.
Yes, and thank you so much for that, Kim. I just wanted to echo that, I'm on the move a lot all the time, but I am a great person to work with. Definitely passionate about the work that we do. And so I just wanted to chime in. So if anyone is interested at all, please reach out.
And with that said, as we come into a new year, we want to reevaluate our meeting time. So I wanted to actually ask everyone that's on to complete this form in real time. And then, of course, we'll send it out in the notes as well. But we're reevaluating our meeting time so that we want to make sure it works best for everyone. And I'll be sending out a new meeting invite for the new year. Of course, over time, we've had a lot of turnover. There's been people that have left their jobs. So we want to make sure that our roster is up to date. So all of that will be included in this new meeting invite. The existing time does remain an option. So if everyone chooses 3:30 at Thursdays, then that's what we'll stick with. We did keep the options for the third Thursday just because of conflicts with other work groups. If we start to see that really doesn't work for most people, then maybe we can explore some other days. But in terms of their SACER's availability and myself, the third Thursday remained really great. So thank you in advance for providing the feedback. We also have a question around whether you prefer the meetings to be 1 hour or 90 minutes. Again, to be mindful of everyone's time and availability. So we can adjust our meeting content based on that selection. So thank you for completing the survey. And now we want to open it up to any community announcements. I will start it off on behalf of our partners. We had a presentation from the Maryland Dental Action Coalition several months back, but they're doing a follow-up right now where they're collecting a survey for Medicaid consumers about accessing oral health care. Now that dental care is is included for Medicaid, people that use Medicaid as their insurance. So we would like to have everyone help us disseminate this survey in partnership with them. So I'll make sure to include it in the minutes, but also here's the survey here for you to share with any clients or just throughout your communities. Sorry, as it's 4:45, apparently I'm starting to lose the ability to use words. And then our quarterly meeting is in December. We would love it if everyone can come. We'll have warm meals catered by Sardi's, and we're expecting presentations from 211, 311, and 988. 988 is going to be talking a little bit about the findings from the first year of implementation of 988, and also some of the sustainable funding that they want to focus on for the future. But then we also have 211 and 311 who will be coming on to talk about some of their connectivity with resources. And we want to see if there's any ways that in Prince George's County we can help support those call centers with information, and if they have any data that we can use to help inform our goals and strategies. So I will put a link in the chat as well, but and this will go out in the notes as well. Please register, and we'll be at Kentland Community Center December 12th at 6.
And just to confirm, Kim, because I see in-person is highlighted, so it's an only in-person meeting, no virtual option available. Is that correct?
That is correct. We are planning to record. Because we're in a different room than our meeting last time, the logistics of a hybrid meeting just didn't seem to be feasible. So we're encouraging everyone to come in person if possible, but we will capture a recording.
Thank you. I think we've had a really great conversation today, especially in moving forward and how to protocol, what's needed to engage with county council, considering a lot of members are new. This is also probably new for some of us as well. Sounds like a standard operating procedures developing that is something that that we can work on if it does not exist already. But really great conversation today. Are there any last comments that anyone would like to share or any other announcements? Well, the holiday season is here. Definitely wishing everyone a wonderful Thanksgiving, happy fall harvest holiday, and hope to see you in December if you plan to attend the in-person meeting.
Sometimes you're a boy or boy.
Bye, everybody. Happy holidays.
Bye.
Thanks,
Thank you so
everybody.
much.
Bye.
Take care.
Bye.
Bye, everyone.